There may only be 10,000 people living in all of eastern Washington's Lincoln County, but through technology, residents have access to some of the best health care anywhere. Lincoln Hospital in Davenport has an innovative partnership with Providence Sacred Heart Medical Center and Children's Hospital to virtually connect patients and their primary care providers with medical specialists in Spokane.
Good afternoon, Ms. Udall. How are you today?
Just fine, thank you. I came into the hospital because of a stroke. I had no idea what it was.
She came in to our ER with significant stroke symptoms, with significant deficits.
I'd like you to stand up without using your hands. Very good. That's nice and strong. Stand up on your tiptoes. Good. Now turn towards that little bed right there and just walk towards there. I just want to see how you're walking. Very good.
We have partnered with Providence to provide telemedicine consults via the robot by hospitalists so that our primary care providers can get a consult, just make sure that we're doing everything that we can possibly be doing, keep the patient here at our local facility, keep the patient close to home, and provide the very best care that we can. And we were able to get the stroke neurologist via the robot within 15 to 20 minutes, have that consult, give her IV TPA, keep her here in-house and watch her recover over the next matter of hours and days, and now be a functioning member of our community again.
Hi, how are you?
Pretty good. How you doing?
I'm just mean and ornery.
You're back to your normal self.
You bet.
Any condition that requires specialty treatment, we can access people that are on the cutting edge of that particular disease process. And I think it's given them a great deal of confidence with using our facility. And the families particularly appreciate that. Many of them from out of the area initially find it hard to believe they can get the best treatment at a small facility in a rural setting, not realizing that we have access to specialty care the way we do with telemed.
The old paradigm was you had to physically be with the patient, and that's what a hospital was all about, was aggregating all the professionals in one place and then bringing the patients to them. And that's worked for many, many years, but I think the ability now is to be able to take the professional to the patient where they're at.
I'd like you to put your arms up just like this. Okay? Now close your eyes.
We were concerned about the reaction of our patients to a robot coming in, and so we were cautious. But I have to say that as we applied it, we were really surprised at how quickly the rapport developed between the patient and the physician inside the robot.
Just to lay here in bed and talk to a fellow that's out of town, that's a specialist in his given field. It's just as if he was standing at the foot of my bed.
Having the ability to keep patients in Davenport that otherwise would have come to Spokane really is a win for that community, a win for that hospital, and keeps healthcare really robust in these rural settings. This is not about providing less of care to people who live in the rural settings who can't otherwise come into an urban setting. It is about providing the same level of care, the same standards of care that are being applied, and in fact, even a better standard of care when you have access to specialists that you otherwise would not have at a much lower cost. So everybody is going to benefit from that.
In the past, a stroke patient would have been transferred, and they may have come back to visit us and they may have had a good outcome, and you feel good about that. But to see it progress in her life, to see the progression of, this really works, and we've returned this lady to full function, very satisfying.
Everybody said I've made a remarkable recovery. And I was driving within 3 or 4 days after I got out. Of course, everybody knows me from driving a paratransit van, and they learned to get out of the way. Never really had anything like this happen to me prior. And it just makes you thankful that you're in a small community like this and you can get the help you need.
Lincoln Hospital's virtual medicine program is allowing patients to access specialty care where they live. It has saved lives and cost by reducing the number of patients who need to be transported to urban areas. Partnering to provide virtual access to specialty care is just one of the ways Washington's rural hospitals are innovating to provide essential care everywhere. To learn more, visit wsha.org/rural.